everyone, and welcome to Portals Improve Workflow and Keep Patients Loyal, a webcast featuring noted healthcare expert Elizabeth Woodcock and sponsored by Intuit Health, the leader in patient-to-provider communications. As many of you know, Intuit Health was created about a year ago when Intuit, the makers of QuickBooks, TurboTax, and Quicken, acquired MedFusion. Since then, more than 1 million new patients have started using the Intuit Health Patient Portal, and the solution now helps more than 3.8 million patients and 41,000 providers easily and securely communicate online. Today alone, patients and doctors will use the online portal more than 150,000 times to pre-register and complete medical forms, request appointments and prescription refills, understand and pay bills, receive lab results and clinical summaries, conduct virtual office visits, and exchange messages for related care and administrative issues. Intuit Health is part of the MGMA Administrative Partner Network, an exclusive group of pre-screened, peer-reviewed, and tested vendors, and also an AAFP Advantage program partner for Patient-Centered Medical Home. My name is Chris Repetto, and I'll be your moderator for today's session. I'll introduce our speaker in a minute, but first some housekeeping items. Today's presentation will last approximately 60 minutes, and we'll save the last 10 minutes for questions and answers. Submitting a question is easy. Simply type your question into the Q&A box on your screen and hit the Submit button. If you don't see the Q&A widget, just click on the red box at the bottom of your screen with the QA in it. You may submit your question at any time during the program, and Elizabeth will answer as many questions as she can. If we run out of time, don't worry. We'll be sure to follow up with you individually to make sure you get the information you need. Slides from today's session, in addition to an Elizabeth Woodcock white paper entitled Portals Keep Patients Loyal, and additional information about Intuit Health are available in the resource web page widget on your console. That's the green button with the open white folder at the bottom of your screen. And shortly following today's broadcast, a recorded version of the webinar will be made available to all attendees. Also across the bottom of your screen, you'll see on the right side some social media links, specifically Facebook, LinkedIn, and Twitter. If you wish to share your thoughts during today's session, please use the hashtag #PoundPortal. Now, without any further ado, let me introduce our speaker. We're honored today to have Elizabeth Woodcock here with us. Elizabeth is a best-selling author, trainer, and professional speaker specializing in medical practice management. She's authored 10 books on practice management, notably Mastering Patient Flow to Increase Efficiency and Earnings. She's a fellow at the American College of Medical Practice Executives and a certified professional coder. Elizabeth earned a Bachelor of Arts degree from Duke University and also holds an MBA in Healthcare Management from the Wharton School of Business at the University of Pennsylvania. So needless to say, if you want to learn more about effective practice management and find out how to improve workflow and increase patient loyalty, you've come to the right place. Ladies and gentlemen, Elizabeth Woodcock.
Thank you, Chris, and thank you to our sponsor today, Intuit Health. Well, Chris, we certainly have an action-packed program today, so let's go ahead and get started. I am so excited to have the opportunity to speak with you all today about a technology in the medical practice industry that not only shows promise, but is truly delivering results. Like you, I have been so focused on electronic health records in conjunction with the government's new EHR incentive program and meaningful use. But I really, truly don't want us to lose sight of patient portals, a technology that can certainly be integrated in your efforts to achieve meaningful use, but I got to tell you, it delivers value so far beyond the confines of meaningful use that, well, it's really guaranteed a return on your investment. In today's session, we're going to talk about patient portals, their functionality, their tie-in to meaningful use, and the patient-centered medical home, and then we'll end with a brief conclusion. In essence, in every medical practice, we have two patient flows. Of course, not only does our payment system reimburse only for the in-office work that you do, but that's exactly where our patients want to be as well. Yet we have a whole entire another workflow that is arguably equally as complex as that which is in our office. So indeed, we have an assortment of functions that happen in this quote-unquote second patient flow. Just look at this list and think about how much time you, your staff, and your providers spend in these various responsibilities. Today, the vast majority of that work, in fact, 100% in most medical practices, happens over the phone, the telephone. Remarkably, for every patient that you see, you receive 4 to 5 inbound phone calls per day. That equates to 75 to 100 phone calls per day per provider. Of course, a practice who has 5 physicians, you're talking about 500 phone calls. And if you're not resolving the issue when the patient or the referring provider calls, you're also managing 75 to 100 outbound calls per day. So you might as well double that number. Now, let me just ask you, we could say, that's fine, we've got plenty of things to manage, we can handle the volume, not a problem, we can just staff to it. It's no worries. But I think we're missing the boat, because if I gathered a focus group of your patients, maybe, 20 or 30 patients into a room, and I talked about your practice. I said, what do you like about your practice? What do you dislike? And I said, please tell me about the phones. Do y'all like the phones? Do you love the practice's phones? Do you just get giddy every time you call the practice? Well, I can almost guarantee the response that I'm going to get. Yes, indeed, a lot of eye rolling. Folks, it's driving our patients crazy. It's driving our patients crazy. And I got to tell you, when I go into your practices, it's driving all of you crazy as well. Managing all of this out-of-office work over the phones. Now, certainly, I have a lot of suggestions that I could offer you to improve the phones, the workflow that happens related to this out-of-office patient flow. And these recommendations include, I really truly think you need a 4-part script for the initial telephone greeting. I want your operators to be directors of first impressions, and they can't be a director of first impression if they pick up the phone saying doctor's office. Think about that. What if you went out and you left this webinar and your anniversary was tonight and you called a restaurant to make a reservation, and for goodness sakes, if they picked up the phone and said restaurant, how would you feel? Indeed, striving for first call resolution is a great idea so we don't have those outbound calls as well as the inbound calls. Monitoring telephone standards, and then my favorite one is, why are we taking messages in the first place? And a requirement for your staff before they do to ask the caller, whether it be a patient, a referring physician, the nursing home, etc., to ask the caller, what can I do to help you? Is there anything that I can help you with before you take the message? And indeed, I've looked everywhere for this book, Amazon.com, Barnes & Noble, and everywhere else that I could find it. This would be in Chapter 1 of the Book of Common Sense, but it doesn't exist. And you know what, folks? We can only get so far, I would argue, we can only get so far in tweaking and refining the patient flow as we've talked. I could give you 14 other points here on this slide, but I gotta tell you, we're not facing the reality that our second practice is not only expensive to maintain. Every one of these calls is costing you money. You got to pay the person to answer, to take the message. You're paying for the phones themselves. They drive you crazy, but you got to pay for them. It's only available when we're open, or when Betty in the front office, our director of first impression, hopefully she is, flips the switch to turn the phones on. And I think that what we really forget is that it requires synchronous communication. On the phones, I've got to be on the phone and the caller has to be on the phone. Otherwise, what happens? abandonment, voicemail, everything that not only drives people absolutely crazy, but totally insane. And I think incredibly important for us, and it was really an aha moment for me, is that we have to recognize that our customers don't want to engage with us in this manner. And we need a different solution. And I really think that's where portals have been able to provide us the solution. So what exactly am I talking about? What is a patient portal? Well, Wikipedia describes a patient portal as a healthcare-related online application that allows patients to interact and communicate with their healthcare providers. Well, as you can imagine, that can come in a variety of formats. But this schematic on the slide is a great picture of how a portal works. Although there are some variations on the model, in essence, it pushes functions. And importantly, they're functions that you choose, that your practice choose to provide. It pushes those functions to patients via your website by interfacing your practice management system and your electronic health record to your website. And it's not a whole nother thing that you have to manage. You've got to recognize that patient portals are fitting within your workflow. They're really just making it better. They're making it better. So, why not just a website? That's certainly at the right where the patient was in the schematic. Why not just a website? Well, websites are, in essence, static. And portals offer service. And in fact, they offer a very particular type of service, and one that I would argue we don't have elsewhere in the medical practice industry, but one that we see almost every time we walk into a restaurant. So just work with me for just 1 second. You walk into Ruby Tuesdays. I don't know about y'all, but when I walk into Ruby Tuesdays, the first thing, it's right there displayed right when you walk in. I look over and I think, oh my gosh, it's a salad bar. I'm going for it. And indeed, I get my menu. It's cheap, $3.99, $4.99. And you know what the best thing about it is? You can get your plate and you can go. You get your food faster and quicker. And so you're saying, well, hold on. How do we get to salad bars when we're trying to talk about patient portals? Because salad bars are a fabulous example of what restaurants have done related to self-service. Why are they offering the salad bar? We think we're getting some kind of great deal. Well, what the restaurant is saying is, oh my gosh, I don't have to have my waitress serve you. I don't have to have my waitress serve you. This is the best thing because you are your own server. I have now made the customer happier, and I've made him or her do my work for me. Now let's step back and think about this. We also have lots of other examples. ATMs, banks offer them. We have, oh my gosh, I don't know about y'all, but do you get those DVDs out of the machines, the red box machines now? Great service. When I go to check in on the airlines, there it is. It's self-service option, the kiosk. We see many examples of self-service in a variety of industries, and many we don't even think about. Can you imagine life without an ATM? What would we do? ATMs provide us so much value, we don't even think about them. We're doing the work. The bank doesn't have to pay the teller. Now, okay, folks, I don't want you to serve black olives and cherry tomatoes in your reception area, but I do want you to recognize the value of self-service. And the beautiful thing is, in our industry, is that patients actually want it. I mean, you can read these statistics for yourself. 94% of consumers rated easy access to their own records as either important or very important. 75% of patients want their physicians to provide online services. 81% would like to schedule their appointment via a secure web service and fill out registration forms online. I mean, think about in your own case. Think about the last time you picked up a statement from your mailbox, a statement from a physician's office, and thought about handwriting out the check and realized, oh my gosh, I don't ever write checks anymore because I pay everything else, all my other bills online. And I don't know about y'all, but I certainly work late sometimes into the evening, and I'll make little notes for the next day. The vast majority, I can just sit there and email and call and do online. But I got to tell you, when I have to make an appointment for one of my kids, it has to be on a little note card, and yes, indeedy, I got to wait till 8:30 in the morning. And when I wait till 8:30, normally I can't get through because everybody else is calling then. And don't let me call from 12 to 1 because everybody's at lunch. The phones are down. So we really, I want a portal. You want a portal. Our patients want the convenience of self-service that portals offer. And I think this is where we're really getting to the point where portals can offer us an advantage in the market. Not only all this great self-service and convenience that we can take advantage of from an operational perspective, but I got to say, I think our patients actually want it. And I think if we can deliver it, we are going to create loyal patients based upon that. So if you are looking at a patient portal, what kind of features should you be looking for? Well, I would recommend that you be able to make the choice, your practice, about what kind of solutions work best for you. Every specialty, every practice works a little bit differently, and so you want to look for a customizable solution because it could be that your practice wants to offer something a little bit different maybe than the practice down the street or across the country. It certainly doesn't need to be said, but you must obviously work with a reputable business that can maintain your data securely and compliantly. The product must also be intuitive for both your patients as well as your own staff. And in fact, I think a great best practice related to portals, and this is where I've seen medical practices do, is they actually start by offering the portal to their own employees, so that you see it not only from an internal operations perspective when you're taking messages, for example, but your employees actually log on as users and indeed use the functionality of a patient portal much as a typical patient would. And that's a great way to kind of start off with your portal. Finally, as you consider choosing a patient portal, know that it must not only support your current infrastructure of management information systems. Remember, I talked about the practice management and the electronic health record. But it also must support your initiatives regarding the current environment of incentive programs, pay for performance, the government's meaningful use initiative, and so forth. So let's go ahead and take just a few minutes to talk about portals and recognize that in most cases, we go back to this list of all the functions that you have in managing this out-of-office work. And in most cases, patient portals can not only manage the flow of work, but they can actually perform the job. So let's talk about the functions and what portals can offer one by one. The first one is, I want to talk to a nurse, I want to talk to a physician. What a portal can offer is secure communication between the patient and your clinical team. Now, the nice part about this, because you might say, well, we could just do that via email. Well, the challenge with that is really twofold. Number one, it's a security issue. Email is inherently unsecure. But I think the other big thing is that the documentation piece, we've got to find a way for this to fit into our workflow. If we don't, then what are we left with? We're left with all of the inefficiencies related to technology and not implementing it correctly, because what are we back to? We're back to printing, scanning, and reinserting it electronically. We can't go there. We need to have it fully integrated. And the beauty of a patient portal that is connected with your EHR is that it seamlessly merges the communication with the patient's medical record and inherently creates a documentation of that conversation. So we're not left with the print, scan, file, which is frankly incredibly inefficient and really takes away from the return that we're hoping to gain from any technological solution, including patient portals. Now, certainly this is no guarantee because, as we all know, in coding and reimbursement, just because there is a code doesn't mean we always get paid for it. But I did want to note that this aspect of a patient portal may also offer a reimbursement opportunity. A revenue opportunity. As you can see, we do have two CPT codes for essentially an e-visit. An online E&M code. And I want you to read the definition very carefully, of course, but note that 99444 and for a nurse practitioner or other non-physician provider, 98969. When you read this could be, again, you've got to perform the task, perform the job, and document it, but it could be an opportunity for you and your practice to have a revenue opportunity out of a patient portal. I would ask that you look not only at the CPT code and its definition, but be sure to check with the payers with which you participate to determine if there is a payment for these services. These codes are only a couple of years old. We used to have a T code, a temporary code, so we're just starting to see reimbursement. As a general rule of thumb, it's in the $20 to $35 range, but I got to tell you, I think all of this is merging right at the same time, and being on the forefront of this is a great opportunity for you. Test results. So let's say, oh my gosh, the secure communications, the clinical communications, Elizabeth, we're not even going there. Nobody's paying for this in our market. We're just not going to do it. Test results. I got to tell you, I think this function alone makes an investment in a portal worthwhile. Why? Because the callbacks related to test results are overwhelming. Remember when it used to be okay? It used to be okay to tell a patient, if you don't hear from us, everything's going to be okay. And we used to tell patients that all the time, right? And what do our patients do? They say, oh, yes, and then they call. They don't want to hear that. If you're going to tell them that, it doesn't really matter. It's going to go right through them, and then they're going to call you back. And what's fascinating is all of those phone calls, again, very expensive to manage. Quite often, we don't have the results at our fingertips. So in essence, every request creates two transactions, two types of work, one in and one back out. Callbacks are also, of course, a frustration for patients. And I don't know, I am recommending now, this sounds funny, but collecting 3 phone numbers on your registration forms. Because everybody has 3 phone numbers now, home, work, and cell. And instead of writing home, work, and cell, my recommendation is to write BEST, B-E-S-T phone number first. But again, there's only so much we can do before we say, let's throw our hands up and realize another solution is in order. And I think this is it. So reducing callbacks, the other thing about test results, as we push test results out through our portal to patients, is that it displays results for patients, and most portals will allow the provider to offer commentary associated with those results. patients can, in essence, 24/7, 24 hours a day, 7 days a week, log onto the portal and see their results. And the other great thing, and I think this is where we really border on improving quality and safety, is that instead of actually getting a phone call about a single test result, a test result just once in time, maybe it was last Thursday, and my doctor calls me about my blood pressure, my cholesterol, et cetera, et cetera. So I get this phone call, and I look at that number. I say, okay, and I hope my doctor's working for me because I just have one data point. The beauty of patient portals is that now our patients have all of those data points. All of those data points can actually see the results over time. And this is where we're really launching into what I'm going to call transparency. And again, it's one of those value adds that a portal can offer. The value adds that a portal can offer that I would argue can actually improve patient care, transparency, instead of making the practice like a black box that we call into when we wonder, where does our calls go? What this data, this nurse, this medical assistant that called me back with this result, did anybody really review it? Is it better? Is it worse? What's going on over there? Portals allow that data to be trended over time, to be viewable over time. And again, with commentary, it really, really gets to transparency. We are offering the patient their own healthcare information, and we are engaging them into their care. Now, indeed, one could say test results are the best function of a portal, but maybe some of you think it's prescriptions, because how many phone calls do you get today? Oh, my gosh. For patients who are calling about their prescriptions. You get a lot. Now, the beautiful thing about this is patients can request medication renewals anytime, anywhere, from any computer. And some of you may be saying, Elizabeth, this sounds all well and good, but I've got a patient population that very Medicaid, a lot of indigent patients. I just don't think a portal could work for them. I don't think medication renewals, they can't request it any time and any place. But we've got to remember, just in the last, I would argue, 12 to 18 months, we all carry, and I'm going to generalize, but the vast majority of us carry a computer in our hands. And I got to tell you, a patient who is a beneficiary of Medicaid, a patient who is without insurance, you ask them, do they have a phone? Do they have a telephone? Most of them do, and that phone is their computer. And I've got to tell you, I've worked with federally qualified community health centers, rural health clinics, who have realized that despite a lot of trepidation, their patients are using the patient portal. Trepidation because they thought, oh my gosh, nobody's going to be able to access a computer. Our patients can't get online. Computer in our hands, and of course, computers also available in public libraries. And, if you've been in a library before, you'll know they're used all the time. Now, in addition to this request 24/7, it provides an efficient, safe mechanism for patients as well as providers. Because really, voicemail is inherently unsafe when it comes to medications, because the voicemails are, this is Mary Smith, and I need my little blue pill that I take in the morning. Wow. What do you do with that one? So this is really a great way to promote safety as well. Now, from a referral perspective, for a primary care practice, patients can be able to request a referral, or you can request a referral on a patient's behalf. And this is where the functionality, and it depends on the portal, but connecting in essence, not just patients and their physicians, but physicians with other physicians. Specialists can accept inbound requests from primary care physicians, or other referral sources. And I got to tell you, not only is this efficient for a specialty practice, but it's great marketing. It's great marketing. So instead of saying, call Lola, who's our referral specialist, who's there from, 8:30 to 3:30 every day, tell us, primary care practice, anytime you want. When you want to refer a patient to us, all you have to do is jump on our portal. Now, I mentioned getting a statement in the mail and actually having to write a check to my doctor. The beautiful thing about patient portals is online bill payment. It puts the power of online bill payment in your practice's hands. And I don't know about y'all, but every practice can use an uptick in revenue for their practice. It allows a patient to communicate questions. It allows you to save, I would argue, a tremendous amount of money on statements. In fact, and you can see my calculation, it's about $8,000 per provider per year that you use to send statements. I mean, think about it. I don't know about y'all, but I've never seen a CPT code for sending out a statement. I mean, this is a pure cost that you can save. Now, the beautiful thing, of course, is that not only do we send a statement on paper, but if we send it through the portal, in essence allow access to our patients through the portal, then our cash flow is improved too, because we don't have to wait till they put a stamp on it, it gets back to the United States Postal Service system, and it gets back to our practice. This allows us to have patients give us the ability to accept payment anytime, any place via online bill payment. So if you have even thought about online bill payment for your practice, a patient portal is a great place to start, because this is the functionality perhaps that you could turn on first, and clearly a cost savings and clearly a cash flow improvement. Now, let's talk about appointments. And you might have seen throughout when I spoke about the functions and out of office that I colored the appointment block a little bit differently. And I say that because I would argue that we want essentially to eliminate the demand for all of the telephone calls that we talked about thus far. Eliminate the demand. Medication renewals, ideally we're asking patients about that when they're actually in the office, and if they're not, then of course we're allowing that functionality through patient portals. So all of this stuff, we're really reducing the demand. We're trying to eliminate the telephone calls altogether. We're never going to get there, don't get me wrong, but we can strive for it, because what we want to do is we want to redirect our staff to helping the physician, the clinician see patients, to get to that in-office workflow. But I got to tell you, for appointments, we need to remember that really, truly, this is our new business development functions. I got to tell you, I like to call schedulers the director of sales, the director of new business development. And of course, what are they developing? What are they selling? That's right, the physician's time. So how can a portal help your practice, in essence, sell your physician's time? Well, it can confirm existing appointments. If you're not already doing this today, I got to tell you, your appointment no-show rate, whether you track it or not, is going up. It's going up because of the economic times. Patients are scheduling appointments and they're not actually showing up for them because they don't want to pay, or they don't have the money to pay. Appointment no-show rates going up significantly. A portal can really help you by confirming existing appointments. Now, this next idea, providing alerts for recommended appointments. How today do you manage? How today do you manage recalls? Recalls, that's what we call this type of thing, where The physician says, all right, Ms. Woodcock, I've seen you today, and I really want to see you back in 12 months. Do we actually give the patient an appointment card? Yes, indeedy. As you can quite imagine, and you've seen them all over your practice, most of the appointment cards are 2 inches by about 4.5 inches, not even. I mean, like 1.5 inches by 3.5 inches. And so on this teeny appointment card, I now have an appointment 12 months from now. Hello. And you think that by calling me the night before in an entire year is going to ensure that I show up? It ain't going to happen. And so recalls then allow you to create a tickler system, a reminder system for your practice that says, we want to see Elizabeth back in 12 months. Handing her an appointment card with an appointment in a year ain't going to work, but we need to make sure we bring Elizabeth back in. And so we're actually going to, I don't know, maybe you go real low tech with your little 3x5 card system and you file my name and you file it 10.5 months from now, so you pick it up and you say, oh, Elizabeth, we got to call her. Or better yet, you use technology. You use a portal to program in your recalls to get patients back, to program in not only those 12-month follow-up visits, but maybe you also need a mammogram. And so we're actually recalling patients. We're reminding them about recommended care that we have without having to pick up the phone. Oh my gosh. Not only is this an efficient workflow mechanism, but I got to tell you, it is great for marketing. Think about that. Wonderful for marketing. It allows you to systematically organize all of those recommended appointments without having to call any report, to analyze anything, get those patients back in. Now, a portal may also be able to help us accept appointment requests. So a patient can go on, and I don't know about y'all, but several of my physicians have portals, and I love it. I go in and I say, you know what, I want an eye doctor appointment for my son, and here's his name and date of birth, and here's when I want it to be, and I send the practice a request. Now, in this case, if it's an appointment request, the practice actually calls me back to make the appointment. We also have true direct booking, direct scheduling. And I have to tell you, I have seen very few practices that are allowing direct scheduling. But folks, it's happening. And I got to tell you, patients absolutely love it. So again, we have two kind of e-scheduling here. We have the appointment request that a portal can help you with, and we also, depending on the product, may be able to facilitate the direct booking of appointments. So let's move on with scheduling, because there's too many things for me to even include in one slide. The option for patients to cancel. Why would I want to say you want to actually cancel a slot or have an option for a patient to cancel a slot? Because folks, if they're going to cancel it, okay, at least they're giving you the heads up that they're not going to attend that visit. They're not going to take advantage of your wonderful, wonderful asset, your physician's time, and it gives you the chance to rebook the slot. And I call this a cancellation conversion rate. In fact, I want you to have a cancellation conversion rate of 100%. Every time a patient cancels, let's get somebody else in that slot. And from that perspective, you would want to make sure that you have a wait list. But of course, don't ever call it a wait list. Call it a priority list. Oh, Ms. Woodcock, if you would like to be seen earlier, we would be happy to place you on our priority list. And what is Ms. Woodcock going to say? Oh, yes, priority list. Yes, I want to be placed on that. This gives you then a priority list. The portal is allowing you to have all these cancellations coming in. You make note of them. It's awesome functionality. Then you rebook that slot. ultimately, I mean, this is a really key area related to decreasing the negative impact of last-minute cancels and no-shows by rebooking that slot. Now, let's think about what happens at the front office. At the front office, Susie's sitting there. We're really excited. The day's about to begin. The patient's shown up for their 8 o'clock appointment, and what do we hand them? Susie hands them, I mean, in many cases, a whole notebook. I don't know about y'all, but I have seen some really thick stacks of forms. And for goodness sakes, just, I mean, as an aside, please go back and make sure you need all of those forms. They look professional, and they haven't been photocopied 53 times and are now skewed. Look at your forms, or better yet, when the patient walks in and Susie greets the patient. Susie greets the patient and she says, "Oh, Miss Woodcock, we have received all of your information. Thank you for completing all of your paperwork via our portal." And guess what, Miss Woodcock? We can go ahead and take you back now. And what I'm really getting to heart of this is we have the opportunity. We have the opportunity not only to eliminate all that paper and the non-professionalism and all that kind of stuff, but we have the opportunity to reduce the transaction time at our front office. Folks, this is really, really big because it takes us 2, 3, 4, 5 minutes, sometimes 6 and 7 with a new patient to process a patient through the front office. If I can even get 5%, I mean, let's go for 50%, let's go for 100%, but if I can even get 2 out of every 20, 2 out of every 30 patients a day registered, completed before they walk in the door, folks, I have now truly enhanced patient flow. I can actually have that patient who's there for an 8 o'clock appointment be seen very close to 8 o'clock, where today they aren't. So a patient portal allows patients to complete their pre-visit paperwork before the visit. Now, I only highlighted what I felt like was really, just some awesome functionality of a patient portal. There's certainly others. Patients can access their records. It's a great promotional point for the practice. You can either, maybe you're a otolaryngology practice with hearing aids. Maybe you have an ordering function, kind of an e-commerce thing going on with your patient portal. Really, I mean, the possibilities are truly endless. If you go back and you think about the salad bar, the ATM, the DVDs out of the box in front of the grocery store, I mean, what can you push? What can you push to your patients that they value that also helps your practice? Now, I hope that you were at least taken by the statements and the advantages that I talked about related to patient portals. But let's say you're not convinced. I'm just going to throw out 2 other things that are going on in the industry that I really think makes taking a leap to portals, I believe, essential. One is meaningful use. Meaningful use is the government's EHR incentive program. Of course, it started January 1st, 2011. You now can register and attest, although there are some state Medicaid programs that haven't started, but the vast majority of physicians can go ahead and participate in the program. There are 25 criteria. Of which you must perform core criteria and 5 of 10 menu-based criteria. I have displayed up here 4 of those criteria that truly are about patient engagement. Now, the government very clearly states that you can provide this information on a thumb drive or a CD-ROM. Okay, so you don't have to have a portal to be a meaningful user. But let's think about this. Okay, there's Susie in the front office, and core criteria, we have to do this. Provide patients with an electronic copy of their health information upon request. So let's say Mr. Smith comes up to Susie and says, "I want a copy of my health information I'm requesting it. What is Susie going to do? Is there now going to be like a drawer full of thumb drives, and Susie's going to pull out a thumb drive and take it and put it in the computer, and we need to teach Susie to do all this stuff. And then when Susie hands Mr. Smith a thumb drive, I mean, think about the security of that as well. Oh my gosh, what if Mr. Smith has a thumb drive that he hands Susie? What about the security of your computer system? So patient portals allow you to eliminate all of these concerns because Susie can now say, Mr. Smith, your electronic copy of your healthcare information is available in our patient portal. And here's some information about how to log on. It's secure, it's compliant, it's all there, and Susie can then go on to the next task after she finishes the conversation with Mr. Smith. So these core criteria and menu-based criteria, when you look at these, it just screams patient portal. It screams patient portal as the most effective way to manage, to achieve meaningful use related to these patient engagement criteria. Now, we also know that patient-centered medical homes, particularly if you are a primary care practice, although I know a cardiology practice that's a PCMH, so it's not just for PCPs. But when you look at patient-centered medical home and you look at the Joint Commission's criteria, the Joint Commission just published their PCMH criteria, and they are launching their program this summer. They are now an accrediting body. But look at this. You, to be a Joint Commission PCMH, access 24 hours a day, 7 days a week to appointment availability, request for a renewal, test results, all this stuff we just talked about. The NCQA, which of course has had an accreditation program in place for several years for patient-centered medical home, they just this spring merged the meaningful use criteria with the patient-centered medical home criteria. And when you read down the medical home criteria that's new for 2011 for the NCQA, I got to tell you, you look at this and you say, we have to have a better way. We cannot manage all of this workflow, all of this out-of-office stuff, all of these tasks. We can't do it over the phone. We certainly couldn't do it to achieve meaningful use, and we absolutely can't do it to be a patient-centered medical home. Now, I would note that both the Joint Commission and NCQA have many other requirements. I just pulled the ones that I felt most spoke to a patient portal. So again, these are, I think, even more reasons to look at a patient portal for your practice. Now, you may be saying, oh, Elizabeth, I'm not some fancy health system that has the money to do all this. And, these things, I can't do it. And I would like to say that the beauty of a patient portal is that it allows even the smallest medical practice to offer the same functionality. And I mean the same, medication renewals, test results, all the stuff that we just talked about. The same functionality you can offer to your patients. You can offer those options on the same level as the largest healthcare system in the entire country. The same level. Absolutely, patient portals are scalable. Now, I really think that portals allow us to be transparent to our patients. They engage our patients. They draw patients in. I want a portal. You want a portal. They're efficient for our practice. The workflow implications, again, all of those requests generating not just an inbound phone call, but an outbound phone call. So the efficiency that can be achieved, where we can really refocus every way from all this crazy nonsense, the back and forth, the callbacks, the messages. And even though we can do it better, don't get me wrong, we can do the messages better. We have an EHR that can help us with that. We can do that workflow better, but we can't ever re-engineer it until we engage our patients. I believe it can make a practice more productive. And particularly when we look at statements, appointment confirmation calls, I mean, when we start looking at what we can truly eliminate from a product perspective, from what we are actually paying for today, we are also looking at patient portals as a cost-effective solution too. So let me return back to my initial comment related to return on investment. Patient portals are here. They are now. With patient portals, the promises of technology is actually delivering results. We are getting the return on investment. Well, I hope this webinar and the content herein has been helpful for you as you think about patient portals and whether or not they are the right option for your practice. Chris, I was hoping that you could begin our question and answer session for our last 7 or 8 minutes of the webinar. Chris, I'll turn it over to you.
Great, absolutely, and thanks so much. It was very, very informative. We got a lot of questions. Again, if we don't get to your question, we will certainly follow up with you individually to make sure you get the information you need. And if you haven't submitted a question yet, it's very simple. Just go to the question and answer widget, type your question, and hit the submit button. Okay, let's see where we are here. What do you think the best way is to drive patient engagement for a portal?
Well, in terms of patient engagement, I think to talk about the benefits for the patient with him or her, and this is going to add a few minutes of time to the interaction that you have with patients. But once patients begin to use it, they are going to become believers in it. So I think it's a great upfront investment, but one that you won't have to talk about your portal for the next 15 years. So talking about it within the practice, I do think, Chris, that you want some sort of promotional piece about it. I do think it should be relatively casual. I worked with a great practice that had a 7-letter rule. Every communication that they gave to their patients had to have words with 7 letters to make sure they actually understood what it said. So I think actually having a patient advocate, and I love that idea too, is to have a group of patients helping you with your portal and other initiatives within your practice. It really brings the voice of the customer home, and it's something that you could have the group maybe meet just once a quarter, have bagels, coffee, etc. And this would be a great piece to share with the patients. And of course, the other beautiful thing about a patient advocacy group, Chris, is that it will allow them to begin to spread the word about your portal too. So the brochure, definitely a notification on your website. And what's the other thing today that you send out to patients? That's right, you send out patient statements. And patient statements are one of those areas where we really can do a better job of including communication to our patients about all different kinds of things, new services, new products, and, Chris, your patient portal. So be sure to slip in a brochure. Make sure you don't have to pay any more postage, but this is a great way to communicate to patients about the benefits of the portal, and make sure, of course, you also communicate about how to log on. Chris?
Okay, great. Next question. What do you think the biggest value of portals are for healthcare providers? Is it quality of care, cost savings, operational efficiency, or meaningful use compliance?
Am I allowed to say?
And which do you think will be the biggest driver?
Sure. Chris, am I allowed to say everything? I mean, I guess from my kind of practice operations hat, and that's really what my expertise is in, that's what excites me about patient portals. It's really it's a technology that's here, that's today, that's usable, that actually will allow a practice to be more efficient. So I guess I'm a little bit biased, and I'm coming from my practice operations background. And that also includes the revenue cycle implications too. But I do think it's very helpful when we look at meaningful use, we look at the patient-centered medical home, when we begin to look at accountable care, and we truly get on board with this whole notion of transparency, because, Chris, we have got to get there. So maybe it's a more overarching benefit of transparency that it's going to be absolutely essential for a practice to be transparent to its patients, because patients are beginning to demand it. And the patient portal, is a way to deliver that. And I got to tell you, just like I think of EHRs, in 10 years, we won't even have the discussion, because I don't know about y'all, but I haven't seen a webinar about how to use a pegboard lately. I mean, we're in this technology. 10 years from now, it is going to be standard. Chris?
Okay, next question. So you've mentioned a lot of positives about having a patient portal. Are there any negatives, for example, cost or maybe increased patient inquiry around positive test results?
Well, I think the negatives are if you say, okay, this sounds all well and good. Let me go ahead and sign up for a patient portal. I think I'm going to do it. But you don't manage it. It's sort of like, having a Facebook page, which I think every practice should have a business Facebook page, not a personal Facebook page. I mean, you could do that too. But if you don't manage it, then it's not going to really be able to deliver the value to patients. So I truly believe that if you're going to look at a portal, that it should be an integrated solution with your practice management and electronic health record, because if we have a standalone portal, it's certainly an opportunity that you could go out and do it, but it does require more management, because it gets us back into kind of that disjointed workflow that I talked about before, which is, we've got to print it, we've got to scan it, we've got to upload it. So to have that seamless integration is going to allow us to reduce the negativity, the negative implications that I talked about by not managing it. So I think that's the only thing I would say is, be careful when you do it. Know what you're doing, manage it, promote it. Otherwise, it'll sort of, kind of hang out there, but you won't have the value. You won't see the value from it. And be really careful about what functions that you choose to turn on. I mean, a great, just simple example is if you're going to accept appointment requests, Chris, and you're not managing it, you're just going to make everybody mad. So I do think that is one of those areas where we truly have to look at this, because we have to be able to manage it for our portals to deliver value to our patients. Chris?
Okay, a few questions around this theme. Do you see the automation of these tasks eventually leading to practices eliminating staff or redirecting the things that they work on every day?
Ultimately, I do believe that we can redirect staff. And I would say, we can cut all our staff, lay off, et cetera. But I think that in the vast majority of practices, we are actually understaffed. We're understaffed because the last 3 to 5 years, overhead rates have shot up. And I used to think that they taught a class in medical school to physicians that is called, when your overhead rate goes up, lay off people. It is like just sort of our knee-jerk reaction to lay off people. And so I think because we're at a very, very, very fine line in terms of staffing, that we have a better opportunity, Chris, to think of a portal as a way to redirect staff. And I do think we have, just use nurses, for example. Many of the nurses, wonderful nurses that we have working in medical practices today, are on the phones. They're triage, they're phone nurses. And a typical triage nurse can handle about 75 phone calls, inbound phone calls a day. Now, if we could take that functionality, that wonderful nurse, and we could actually get him or her back into the exam room, maybe not all day, but back on the floor, working with the physician, working with the providers. And of course, a registered nurse can bill a 99211, that we then are redirecting that nurse to improve the care and communication for patients and we're really, really focused on what I would call that in-office workflow, our first practice. So I would like to think of patient portals as a way more of redirecting staff, and I say that only because I really think that we're understaffed. And I'm generalizing, don't get me wrong, but for many practices we're understaffed today. Chris?
I think we have time for one more question. I'll summarize a few with a similar theme. Is there any certain patient age that are more apt to use a portal? And there were some questions around elderly patients who may not be as computer savvy, and how does that impact the use of the portal?
Well, Chris, the statistics are overwhelming. Portals and online presence for all generations are incredible. And I use the example of patients that don't have insurance and a federally qualified community health center thinking, oh gosh, I mean, these patients aren't going to get online. They do. I mean, the fastest growing group of Facebook users are Americans over 65. I really think that our patients of all ages are going to value that transparency, that self-service. And you know what, folks? The beautiful thing is we're not going to turn off our phones. At least I hope y'all are not going to do that. I mean, you're not going to shut your doors. You're not going to say, this is the only way that you can reach us. I think it's incredibly important to note that patient portals are an additional vehicle, an additional value add to our patients. We're not going to shut off communication vehicles and all other avenues. So if you are concerned that all of your patients aren't going to do a portal, that's totally fine. But putting it out there is going to offer that subset, which is growing of patients who do value that self-service, who do value that 24/7 access, who do value, very importantly, that transparency. So personally, I don't think this is something that you should be concerned about in terms of patients going on, but it might be one of those issues that you discuss in your patient advocacy group and you seek feedback from patients, from your own patients, about how you can make it easier to use. Well, Chris, it has certainly been a pleasure to work with Intuit Health and be able to talk about patient portals with all of our audience today. If you could go ahead and close our webinar.
Okay, absolutely. Well, thank you, Elizabeth, and thanks everybody for joining us today. And we probably have about 50 unanswered questions, so you've obviously piqued everyone's interest. And like I said, we'll be sure to get back to everyone individually to make sure your questions are answered. And as I said earlier, the slides, Elizabeth's white paper, and some more information on Intuit Health are available for downloading at the resource widget, which is the green button at the bottom of your screen. And we'll be sending an email to you with a recording of today's session to all the attendees. And if you would like to learn more about the Intuit Health Patient Portal, you can contact Walker Winchester, and his contact information is, I believe, going to be put on the screen shortly, and it can also be found at the resource widget. So shortly following the broadcast, you'll get an email with a recorded version of today's session. The email will go to the address that you registered for the webinar, and also in that email, we appreciate you filling out. There's a short survey just about your thoughts and reactions to today's topic, so we appreciate you filling that out for us as well. So thank you to the folks at On24 for helping us today, and on behalf of Elizabeth Woodcock and Intuit Health, we hope you found today's information interesting and beneficial, and this concludes today's session. Thank you very much, and enjoy the rest of your day.